So we're going to approach this from the perspective of the musician. And we'll talk a little bit about what's different about musicians than other occupations and other occupational injuries, and then how we approach our assessment and ultimately our treatment. So just so that you have a little bit of an understanding of the incidence and prevalence of overuse injuries in musicians, I think it's important to recognize and acknowledge that 62 to 93% of all musicians will have one incidence per lifetime of their playing career. So that's pretty much 100% chance that a musician will get injured. There are 30 million musicians in the United States. I don't know what that translates to internationally, worldwide, but for the global community, but this includes amateurs, children, students, and the hobbyists, as well as all professional musicians. So there are a lot of people playing instruments with significant health costs. And in surveys of orchestral musicians and other musicians, we find that there's an incidence of at least 84% of what we call performance-related musculoskeletal disorders. Over 50% report no recovery, meaning they play with pain and with injury. 20 to 24% in some studies report that they've had to take time off from work. So we have high numbers that are associated with specific pain in the hand and arm. And we know that these injuries are associated with certain risk factors. Our approach is based on what are the demands of the instrument, what are the unique risks facing this individual player, and how do we develop this individualized treatment strategy.